Hello. If you are watching this, you or a loved one has likely been diagnosed with a gallbladder condition requiring surgical intervention. Today, I want to walk you through the procedure known as laparoscopic cholecystectomy, or keyhole removal of the gallbladder. You may have presented to the clinic or emergency room with specific symptoms. Most commonly, patients experience pain in the right upper abdomen, often triggered by eating fatty meals. This pain might be accompanied by nausea, vomiting, and sometimes fever. In more severe cases, you might notice jaundice, yellowing of the eyes or skin, though many patients present without it. Your diagnosis is likely cholelithiasis, gallstones, or cholecystitis, inflammation of the gallbladder. We often see findings such as a distended gallbladder, thickening of the gallbladder wall, or stones stuck at the neck of the organ. What causes gallstones? Before we discuss the surgery, it is helpful to understand why this has happened to you. Gallstones are essentially hard deposits that form inside your gallbladder. 1. Chemical imbalance. Your liver produces bile to help digest fats. This bile contains cholesterol, bile salts, and waste products like bilirubin. If your bile contains too much cholesterol or too much bilirubin, it can harden into stones. 2. Gallbladder function. Sometimes, the gallbladder does not empty completely or often enough. This allows the bile to become overly concentrated, leading to stone formation. 3. Risk factors. While anyone can get gallstones, certain factors increase the likelihood. Diet. Diets high in fat and cholesterol, or low in fiber. Weight. Being overweight or losing weight very rapidly. Genetics. A family history of gallstones. Medications. Certain cholesterol-lowering drugs or medications containing estrogen. Why do we need to remove the gallbladder? Once gallstones cause symptoms, they tend to recur. Leaving them untreated can lead to serious complications like severe infection, acute cholecystitis, blockage of the common bile duct, leading to jaundice, pancreatitis. Surgery is the gold standard treatment to prevent these future attacks.
However, there is another specific condition I want to address: cholelithiasis, stones in the bile duct. Some of you may have had a condition where stones slipped out of the gallbladder and blocked the main bile duct, causing jaundice or infection. Status post-ERCP. You might have already undergone a procedure called ERCP, endoscopic retrograde cholangiopancreatography. This is where we passed a scope through your mouth to remove those stones and placed a small tube called a stent in the bile duct to keep it open. Why surgery now? You might wonder, if the duct is clear and I have a stent, why do I need surgery? The answer is that the gallbladder is the factory where these stones formed. Even though the duct is clear now, if we leave the gallbladder, it will likely produce more stones that can block your stent or cause severe infection. The plan. We perform the laparoscopic cholecystectomy now to remove the source of the problem. The stent in your bile duct will typically be removed in a minor follow-up procedure 2 weeks later. The procedure, laparoscopic cholecystectomy. The procedure is performed under general anesthesia, meaning you will be asleep and feel no pain. Here is exactly what happens. Preparation. You will be placed in a supine position, lying on your back. We administer antibiotics to prevent infection and use compression devices on your legs to prevent blood clots. Access. Instead of a large open incision, we make small keyhole incisions. Typically, we use one small cut near the navel, infraumbilical, and 2 to 3 smaller cuts, 5 millimeters, in the upper abdomen. Inflation. We gently inflate your abdomen with carbon dioxide gas. This creates space for us to see clearly and work safely. Dissection. Using specialized instruments, we identify the Calott's triangle, the critical area containing the cystic duct and cystic artery. We carefully clip and divide these structures. Removal. The gallbladder is then separated from the liver bed and removed safely through one of the small incisions using a sterile bag. Closure. The small skin incisions are closed with absorbable sutures or skin glue and dressed with sterile tape or waterproof dressings.
Risks and complications. Laparoscopic cholecystectomy is one of the most common and safe surgeries performed worldwide. However, as with any medical intervention, informed consent requires you to understand the potential risks. Based on clinical data, these include common side effects, pain and discomfort, up to 80%, and shoulder pain due to the gas used common. Infection. Wound or port site infection occurs in about 2 to 5% of cases. Bleeding. Minor bleeding or hematoma affects 1 to 2% of patients. Bile leak. Leakage from the duct stump or liver bed occurs in 0.5 to 2% of cases. Rare but serious injuries. Injury to the main bile duct, 0.3 to 0.6%, or surrounding structures like the bowel, less than 0.5%. Retained stones. Occasionally, A stone may remain in the bile duct, 2 to 3%. Management of complications. Rest assured, we are equipped to handle these rare events. Asterisk. If visibility is poor or anatomy is unclear, we may convert to open surgery, making a larger incision, to ensure your safety, happens in 2 to 5% of cases. Asterisk. If a bile leak or retained stone occurs, it can often be managed with a subsequent endoscopic procedure, ERCP, or a drain.
Post-procedural care and recovery. After surgery, you will be monitored in the recovery room. Most patients go home the same day or the next day, once they are tolerating liquids and moving around. V. Detailed post-procedural care and recovery. Your recovery at home is just as important as the surgery itself. Here is a detailed guide on how to care for yourself over the next few weeks. 1. Immediate aftercare and safety. For the first 24 hours, you may feel sleepy. Please rest, and do not make any important personal or business decisions during this time. Do not drive or drink alcohol for at least 24 hours, or while you are still taking prescription pain medication. Please ensure you have a responsible adult with you for the rest of the day and night after you return home. 2. Wound care and showering. You will have 4 to 5 small incisions on your abdomen. The care depends on the specific dressing used. General rule: keep your dressings clean and dry for the first 48 hours. Standard dressings. You may remove the outer dressing after 48 hours. You can then cover the incisions with Band-Aids, or leave them open to air, whichever is more comfortable. Waterproof. Tegaderm. If you have a clear plastic dressing, you can leave it on for 5 days, as long as there is no leakage, and remove it when comfortable. Steri-strips. If you have thin white tape strips, leave them alone. They will fall off on their own in about 10 days. Skin glue. If we used skin glue, do not rub, scratch, or apply any ointments to it. It will naturally slough off in 5 to 10 days. Bathing. You may shower after 48 hours. If you have skin glue, you may shower after just 24 hours. Important: no swimming or soaking in a bathtub for at least 2 weeks.
Diet and digestion. Your digestive system needs time to adjust. The first days. Start with clear liquids like water, coconut water, soup, or juices to prevent nausea. Eat smaller meals more often, rather than fewer large meals. Foods to avoid. 1 month. You must avoid fatty foods for about 1 month. This includes hamburgers, whole milk, cheese, and fried snack foods. If you have an upset stomach, try bland, low-fat foods like plain rice, broiled chicken, toast, and yogurt. Preventing constipation. Pain medications can cause constipation. To prevent this, drink plenty of fluids and eat foods rich in fiber like whole grains, fruits, and green leafy vegetables. Avoid constipating foods like red meat, pizza, frozen dinners, and sugary pastries. Managing diarrhea. If you experience loose stools, avoid spicy foods, dairy, and fatty items. If it continues for more than 2 weeks, please contact us. Advance to a regular diet as you tolerate it. 4. Activity and work. You should walk and ambulate as soon as you are fully awake. However, avoid all strenuous activity and heavy lifting for 2 weeks. Asterisk. We typically recommend taking sick leave for 5 days to ensure you rest adequately. 5. Medications. We will provide you with a specific prescription, which typically includes pain relief, paracetamol, 1,000 milligrams, taken 3 to 4 times daily for 2 days. After that, if required. If pain is severe, you may take tramadol 50 milligrams up to 3 times daily. Nausea. Medications like Emest, Zofran, can be taken if you feel vomiting sensations. Stool softeners. We prescribe lactulose syrup or Movicol powder for 10 days to keep your bowel movements regular. Gastritis. If you feel acidity or burning, you may take pantoprazole or sucralfate syrup. 6. Special instructions. If you have a drain. In some cases, if there was infection, we may place a small tube called a JP drain. If you have one, empty the bulb when you get up in the morning, or if it gets full, wash your hands thoroughly before and after handling it. Record the amount of fluid and bring this record to your follow-up visit. Remember to squeeze the bulb to remove air before closing the cap. This creates the suction needed for it to work.
7. Normal symptoms versus emergencies. Finally, knowing what to expect can reduce anxiety. Normal. It is normal to have shoulder pain or chest tightness for 24 to 48 hours due to the gas used in surgery. You might also see a large bruise, black or blue area, moving from your abdomen to your hip. This will turn yellow and disappear over time. However, please seek emergency care if you experience fever greater than 101.5 degrees Fahrenheit, severe abdominal pain not relieved by medication, Unable to urinate for 8 hours. Redness, warmth, or discharge from the wounds. Yellowing of the eyes, jaundice. We will typically review you in the clinic in 1 week to check your wounds and discuss your biopsy report. The removal of the gallbladder is a highly effective procedure that will relieve your pain and prevent serious infection. Our team is here to support your safe recovery. Thank you for trusting us with your care.